Risks of vitamin D deficiency in pregnancy. Preeclampsia. Low vitamin D levels are associated with an increased risk of preeclampsia, a pregnancy complication marked by high blood pressure and organ damage. Gestational diabetes. Deficiency may raise the risk of developing gestational diabetes, which can lead to complications for both mother and baby. Preterm birth. Inadequate vitamin D levels can increase the likelihood of premature delivery, before 37 weeks of pregnancy. Low birth weight. Babies born to mothers with vitamin D deficiency are at a higher risk of having a low birth weight, which may impact early development and health. Impaired fetal bone development. Vitamin D is essential for calcium absorption and bone growth. A deficiency can affect the baby's skeletal development. Weakened immune function in baby. Low maternal vitamin D may impact the baby's immune system development, increasing vulnerability to infections after birth. Increased risk of rickets in infants. Deficiency in the mother can lead to low vitamin D levels in the baby, increasing the risk of rickets, a condition that weakens bones. Postpartum depression. Some studies suggest a link between low vitamin D levels and a higher risk of postpartum mood disorders, including depression. Delayed language or motor development. Emerging research indicates possible links between maternal vitamin D levels and early childhood developmental outcomes. Higher risk of cesarean delivery. Some studies suggest that severe deficiency may be linked to a higher rate of cesarean section deliveries. Here are additional risks and concerns related to vitamin D deficiency during pregnancy. Poor placental function. Vitamin D plays a role in placental development and function. Deficiency may impair nutrient and oxygen transfer to the baby. Impaired brain development. Studies suggest that low maternal vitamin D may affect fetal brain development, potentially influencing cognitive and behavioral outcomes later in life. Increased risk of autoimmune conditions in offspring. Some research links maternal vitamin D deficiency to a higher likelihood of autoimmune diseases in children, such as type 1 diabetes and asthma. Increased risk of miscarriage. Low levels of vitamin D have been associated with a greater risk of early pregnancy loss in some studies. Dental allotment issues in the baby. Inadequate vitamin D can affect the development of healthy teeth and enamel in the fetus. Altered gene expression. Vitamin D influences the expression of several genes involved in fetal growth and immune regulation. Deficiency could impact these processes. Long-term health effects in children. Emerging research suggests that maternal vitamin D status may influence the child's risk for obesity, heart disease, and metabolic disorders later in life. Greater postnatal complications. Babies born with low vitamin D may be more prone to infections, slower growth, and issues with calcium regulation after birth. Maternal bone loss. Pregnancy increases calcium demands. Without sufficient vitamin D, the mother may lose bone density, increasing future osteoporosis risk. Reduced breast milk vitamin D content. If the mother is deficient, her breast milk may lack adequate vitamin D, putting the newborn at risk even after birth. Thank you for watching my video. Please like and subscribe, and comment.